Now, we've come across, you've heard a lot of different things from chemo and bullets and vaccines and how radiotherapy screening is essential, but also radiotherapy is essential, and how you can also connect to information that's important to accompany you through this whole journey. So what questions do we have from our audience?
What about liquid biopsy? When talking about personalized medicine, are you working with this?
I think there'll be more people that answer the question. So the answer is increasingly, I think that will become a reality. The reason it hasn't yet is because the technology hasn't been, just as was mentioned by one of the panelists talking about sensitivity and specificity. It has not shown yet for breast cancer a high enough pickup rate early on. And then the paradigm of, if you find some noise that suggests it could be breast cancer, then what do you do? Optimally, and the question is, can you find, the answer is almost always yes, just like with radiology. The question is, will it then lead to the paradigm that by finding something within the technology's ability to pick it up, that it'll do so accurately enough and not causing many people harm who it was done erroneously, that you can then do something about it that improves outcome. That's like all these things, just like with mammography, one of the other speakers alluded to, why it's still the gold standard, because it has met all those criteria. I think the tests are getting better. I think in some cases it's trying to catch cancer even earlier. It has to be within the confines of then being able to find it at on a clinical level and do something about it. So one of my colleagues who's at the National Cancer Institute leading a couple of these studies is doing just that for late stage disease, and another study in early stage disease. So I do think the time is right now to investigate it in a clinical setting, where you have to also create the paradigm that asks, what can you do about it in those patients who test positive, right? And then the question at the same time is, how about the patients who test positive and you're not finding cancer on a mammogram, MRI, or sonogram? What do you do then? That's part of this whole package.
Yeah.
I believe this will be used, as was mentioned by one of the other speakers, more so in patients who, for many reasons, are deemed to be at higher risk, and wherein those patients may have potentially more benefit than harm. So I do believe this is going to happen as the technology and the paradigms all align.
Thank you so much.
Thank you. Great question.
Hi, thank you. This has been so informative. I'm definitely rewatching this on YouTube because it was so dense with information, but all of it was terrific. I just have a question. It's a bit of a meta question, more about the infrastructure of the research. You see how in the States so much of the funding for research, medical research, is being cut. And I want to know what implications that has. Are centers for a lot of innovation? Is this very widespread, or are there just a few nodes that are doing a lot of it? So that, is this research going to continue at this rapid pace that has been so useful for all of us, and that we're hearing how much it's saving lives?
I'll speak for the United States side begrudgingly about that, and I'll invite my colleagues. 35 years ago when I started, there were centers all over the world that did cancer research, not just breast cancer research. But truly at that time, there were fewer of them. There was less expertise, and there was less research in terms of that. What has happened is a diaspora of knowledge and investigators that were trained, that went to all over the world and have opened up other cancer centers, and there's been tremendous growth in research. This is not about one center, it's about all the world looking at many things from different sides, and that has been fantastic. And by the way, it's because women who are advocates for breast cancer have also shaped that. The United States, we have something very special called the National Institute of Health and National Cancer Institute, which is probably, and I won't say anything more, but the preeminently funded and a preeminent cancer research center for basic research, meaning very elemental research that's done early on to understand the underpinnings of cancer, that's very expensive, that has to be invested in for then once you find these advances, that you can then take them quickly through clinical pharmacology, biotech companies that then bring it to the clinic for clinical trials and then possible approval. That early part, no one really pays for it. It's not commercializable until it goes into late development. So the gift of the National Cancer Institute, and by the way, other centers like it around the world, and in Europe, they fantastic basic translational research is ongoing. So when you hurt that, and I don't mind, I'm not getting political beyond that. When you hurt that type of institution irrationally, what's going to happen is a lot of the funding will stop. You get my mentees calling me and saying, I have to leave. My career doesn't go on here. Does it affect other people wanting to go into research careers at that level in those kinds of institutions? And so right now, the word is a little bit of chaos. I say to my European and Asian other colleagues who are much more level-headed and pragmatic, but I'll quote Winston Churchill, who was supposedly said that the Americans do the right thing when every other opportunity has been tried and failed. I think this is going to be something that will hopefully be salvaged in the future. Research is continuing, and it's going to be a little different, perhaps in the short term. Pharma and biotech will be doing more. The NCI will still function, but we're all nervous about it. So I got out ahead of everyone else, but I do welcome other people's thoughts and comments.
So the US, compared to many European countries, are quite a paradise with publicly funded research. And in the US, far more than 50% funded by public money, and in Austria it's less than 10%. So we heavily depend on pharmaceutical companies to cooperate, or what's the other opportunity to collaborate with European networks, which we do quite successfully, but it's we certainly have a lack of money compared to the US.
Any comments on that?
Yes. So I think you also have to pay attention to the data that's being collected, because I think it was 2019 when we collected 250 zettabytes data resulting out of cancer trials, and all these advancements in cancer treatments also result out of this data. But up to this point, there is only, I think, I don't know, at 2021 it was probably 5% of data being processed out of that, and by now we're probably at 40% of that data being processed. So I think there's a big also demand on educating people, being able to identify the quality and define the quality of data that's being collected in order to have bigger access to data that could be used for other things, and also people who are able to actually process that data in the end of the day. And there's a huge gap there right now. And I know that also from my former time in banking and fintech, where we had the development and randomly data was collected and no one knew what this data could be used for, what quality it had. And then we know, okay, we found out, okay, 50% is useless. So I think that also has to be a point of attention.
Now, both Alexandra and you mentioned the Netherlands in many of their things. Is the Netherlands well funded in comparison within Europe?
I don't know about the funding, but there are many things very well structured, and they have clear algorithms, and they also stick to the protocols.
yes, there's a lot of data and there's a lot of research going on in the world. Unfortunately, the collaboration and sharing of data is not perfect. A lot of data does not, there's consortiums now, people working together more and more, but data is not necessarily, certain types of data from certain grants has to be publicly shared, but there's not enough sharing. And part of that is because of sources of funding, and proprietary knowledge leads to commercialization. I'm just going to say that that's something that is a shortcoming of research, but increasingly there is more sharing. So that's the other that's the other thing that we all have to get better at doing, because if you don't share, then people may not see things that you don't see that can then leapfrog. And if you don't share, then people start to wind up doing and repeating things and costing money and losing time for things that have been done and not working.
I think
So there's actually websites where that is now being published.
I think that's a super important point, and there also needs to be a shift in the mindset of who owns the data and who gives access to the data. And actually, we're working on a pilot in the US right now with Be Accepted that addresses exactly that topic, where we try to shift that. And let's see if it works. We'll keep you posted.
Damiano Sumilidis had a question.
Yes, hi. Thank you for this very interesting discussion. So you mentioned screening, prevention, treatment, and so on. And you mentioned also that it could be that you are, if you have cancer, you are financially challenged. So my pragmatic question is, what does public insurance cover all of that?
Well, in Austria, we're
In Austria, of course.
very lucky because we are in a very solidary, established healthcare system. So they do cover a lot. So first you're covered by, in the first year you're covered still by the ÖGK, and then you move on to your pension, whatever insurance you have. So if you're employed, they do cover a lot. And what they don't cover is like all these complementary things if you don't have an extra insurance. So they won't pay for yoga classes or whatever. So, but in general, the treatment to cover, and the treatments are really fantastic what you can get. So we're very lucky to be living here in Austria.
Thank you so much for this very informative evening, all four of you. One question, is there any research if a person has got cancer and has done all the treatments, that the vaccine afterwards makes any sense?
We have quite good data for women who are treated for pre-cancer and who have undergone surgery for pre-cancer of the cervix, that they benefit of the vaccine. So the recurrence rate is dropped by 60%, but we don't have any data on patients with invasive cancer. But you have to keep in mind, once you have one HPV-related disease, you're at risk for other diseases caused by the virus. And you might potentially lower your risk, especially when you have a good prognosis. So when your cancer is detected quite early, at the cervix, for instance, you might reduce your risk for HPV-related vulvar cancer or anal cancer in the long run.
Hello, I'm Michael Miksche from Vienna. We're excited about your talks, but I want to continue on research in Austria. And I think we have a very special institution. We have the Cancer Research Institute, and which is devoted to especially translational research. And also we have the exciting research at the General Hospital of Vienna, the Medical University of Vienna. And exactly today, there is an international congress ongoing on early breast cancer, which is the Shanghai Breast Cancer Conference, where about 5,000 people are coming together, and will Austrian group, which is headed by Professor Gnant. And there are comprehensive cancer centers all around, so in Vienna, in Innsbruck, and also in Graz. And there we have really the choice or the chance to work together. And what we also have is a big enthusiasm, and which saves a bit of the money. And that's what I wanted to say. Thank you.
Well, actually,
Can I
you can comment, and then I just want to introduce him, because at the end, he's going to be saying something about where our charity is dedicated. So go ahead, Alexandra.
Yes, next week is the St. Gallen in Vienna, and it's a very huge conference. And I think we take advantage from we have the Austrian breast and colorectal cancer science group, and we take advantage of our small country. In Austria, about 30% of all breast cancer patients are treated in clinical studies. So this is very difficult in a large country, but in Austria we take advantage of that, and therefore we were very successful in participating in international science, and we presented some data for every year in San Antonio, in St. Gallen, and yes, Professor Gans is the head of it, and it's a really good study group. I can just underline this fact.
It's wonderful. So now I'm conscious of our time, and I'm going to introduce Dr. Mikshu, but I just wanted to find out, can Dr. Raptis see us? Can you see us?
I cannot see you, but I
so you're
wish
blind,
I was there.
So I know, we wish you were
But
here too.
it's absolutely fine. I'm enjoying everyone's comments. So
well, because
no
I was going to get everybody up to wave to you, but that's not going to be possible.
I'm going to have to leave, unfortunately, folks, because I've booked things. I just want to say thank you for the invite. I thank you for the lovely conversations. You have a lot to be proud of. I think the speakers that I've been part of the panel just really have taught me, as people always do, so much more. And I think the key word is collaboration, not just between scientists and clinicians and health systems and countries, but with people who are at risk for and have these diseases, because they have tremendous insight. So I'm going to unfortunately leave.
Yes,
but I really wish I could stay longer. This has been fabulous for me. Thank you,
Dr. Raptis. Thank you so much.
My very best to everyone.
So it's been a pleasure to have him. We have 2 more words now. We finished. We're conscious of the time. We have University Professor Dr. Michael Mikshu here, who just made that comment, and he's going to say a few words about the Austrian Cancer Society. He was the former director of the Cancer Research Institute at the AKH, past president, current board member, and Präsidiumsmitglied of the Austrian Krebshilfe, and still leading the working group of research. And we thought it would be very, very moving for you to explain the Austrian Cancer Society, as you are the designated charity for tonight's event.
So really, I enjoyed these presentations and very much, and thank you for all your contributions, especially yours is really covering what we as a cancer aid is really want to have our patients. Cancer Society was founded in 1910 and under the patronage of the Emperor Kaiser Franz Joseph, and it started really as a research institution and was devoted to therapy and prevention of cancer at those times. We have now initiated in 1980 the Cancer Aid. This is more devoted to cancer patients, but not to so fast cancer research. And we have now in each federal country one organization which is responsible on their own and devoted to what is the ideas of the Cancer Society. First, it is campaigning and information of the population, helps the patients. This is very important. We have these counseling centers in each country. And finally, we have devoted some of our activities to the support of cancer research. And most important, I think, is besides the campaigning, and you may know all this HPV campaign, Pink Ribbon campaign, Loose Tie, which is for breast cancer or prostate cancer, and also Don't Smoke. Or now we have the campaign for colorectal cancer. What is important for us is the help for the patients. We have in every country a counseling center, and this has really the most important option is to help the patients in their fight against cancer. And one important thing is the psycho-oncology. And this is what we really offer in our center in the 11th district in Vienna. The problem is that cancer patients, most of them have a problem with stress situations. They have anxiety, they have the fear of relapse, and they have problems, distress, and distress is present at every moment of the cancer. You have it when you receive the diagnosis, you have it when you start with therapy, you have it with end of therapy. And this is what the patients really have to cope with, and we help them to get back in their life and to gain a good quality of life.
So I want to thank everyone here, Caroline, Alexandra, Elmar, and of course Dr. Raptis, and thank you for coming. Is there anything you want to add before we let everybody go get their wine, water, and things? Do you want to say something? Okay.
Just a fun fact. So the Agnodice, Agnodice, Agnodiki, does anyone know this name? Ancient Greece, 500 years BC, 470 or something. Agnodice was a young woman who wanted to become a gynecologist. Back then they weren't called gynecologists, but a doctor for women. So women were not allowed in ancient Greece. Ancient Greece was a great place, wonderful wisdom, everything. Women were not allowed to study medicine. So, and she wanted to be a gynecologist. And she had very good parents. They sent her to Alexandria, which was a booming center for trade, Greek center for trade. And there she was able to study with some of the best. Came back to Greece, to Athens, and she dressed as a man and started working as a doctor. So, and she was saving so many lives that she caught attention. There was a lot of attention saying, what's going on? Who is this person that came out of nowhere? So, and they found her, and she, that it was a she, and she was sentenced to death for practicing medicine. And she went to the Areopag, the Supreme Court, and they allowed her to continue to practice. And she, in the beginning, with a man being there to make sure that she's doing everything right. So, and she was actually the force that actually eventually allowed women to start studying medicine in Greece and all that. So she was a very important woman. A little fun fact for the March 8th. And the other thing was that women in factories, when there was a factory in New York where they were working and they were on strike and they were burned to death in order to stop them from striking many years ago. And that was the 8th of March. And this is one of the reasons why it's called Women's Day. And I've heard so many times, why do they need a Women's Day? Why do they? I said, well, it's very important, because it's not really just a celebration. The commemoration, we have to remember how many women have struggled for us to get as far as we are today. And we still have a long way to go. We still need, I know that Dr. Raptis is very, very strong on personalized medicine, and we need medicine for our bodies and for our minds. We are different than men, but most of the medications that we're having are based on tests on men. So these are things, we have a long way to go in that, gender medicine. And I wanted to thank also everyone. And I think Dr. Joura recognizes this bag. He was at his own, another, this was from another cancer Tagung just a little while ago. So I have, this is old bottles that I've cleaned, and this is oil from Greece, 5 generations organic. From friends of mine. It has the daughter of Penelope on it. I'm sorry, I didn't get the little carry bags. So ladies first. There you go. And it says thank you on it. And I just pumped it out of the canisters today, so it's fresh, fresh, fresh. It's the absolute first. You do too. The absolute first press. The first oil in the whole district that goes to the machines. So it is not contaminated from any other oils from the Peloponnese. So enjoy that with your foods. And there was one more thing I wanted to say. Wait a minute. Yes. Krebshilfe, we've started a campaign to raise money for people who have a cancer diagnosis who need psycho-oncological help. It is a roller coaster ride. I know I've been there. My husband has been there. And it is so important to go to Krebshilfe. If you know anybody who has cancer and they have a new diagnosis, we can continue the conversations over a glass of wine or juice. And some snacks. Thank you very much for coming. Thank you.